How many check? I think I use computer too much and kena lazy eye.
Why is my degree higher on the right? Is it because it's lazy?
I have lazy eye on my left eye because I always use my right eye to see.
Right, so welcome to another episode of I Know La. Today we'll be touching on the topic of lazy eye and we find out what it really is. We'll also address some of the common misconceptions about lazy eye that we encounter on a daily basis. Lazy eye generally refers to what we know as amblyopia, which is the condition where the eye has poorer vision due to abnormal vision development in the eye. So when a child is born, the eyes are still developing and need external visual stimulus to help with its development as the child grows. These visual stimulus help to develop the eye by triggering the development of the brain-eye neural pathways. So this will help us to realize the eye's full potential when the child grows up. There are three conditions which can affect the normal development of the child's vision. Firstly, the child may have muscle imbalance in the muscles that help to position and align the eyes. This may cause the eyes to turn in or turn out and prevent them from working together properly. This is what we commonly known as a squint or strabismus. The second way that it can affect the eye's normal development is the refractive error, which we also know as the degree. Fun fact, almost all babies are born long-sighted and the eyes will slowly become zero in the first 2 years of their life. This process is called emmetropization. For some children, their eyes remain long-sighted and sometimes a little bit too much. This is an issue for eye development as the visual stimulus is usually some close-up object which is in the playpen or just around the baby's surroundings. If they are still rather long-sighted, this can prevent them from seeing close-up objects clearly and this will in turn affect the development of the eye. The third condition that can affect the child's eye development would be vision deprivation. These are usually caused by cataracts or droopy eyelids. This effectively blocks off the vision from the inside and makes it almost impossible for the retina to receive any stimulus. Vision development happens only during the early years of childhood. If this is left untreated, the child will grow up to have relatively poorer vision and this is a permanent process. As amblyopia has little or no symptoms, it is important to have your child's eyes screened as early as possible to identify any potential cases so that treatment can be done early. Treatment options can involve prescribing glasses, patching therapy, or even surgery for cases with droopy eyelids or cataracts. So now that you understand what lazy eye is, let us go through some of the common misconceptions about lazy eye and why they are not entirely always true.
How many check? I think I use computer too much and kena lazy eye.
This may be a case of digital eye strain, which is actually the eye feeling tired after prolonged usage of digital screens. We hear this quite often, but the truth is that lazy eye cannot develop in adulthood. That means if you are able to see 6/6 in school, your eyes cannot undevelop and have poorer vision due to lazy eye. If there is vision loss during your adulthood, we will need to have your eyes examined to establish what is the cause of this vision loss.
Why is my degree higher on the right? Is it because it's lazy?
No, it's not because the eye with a higher degree is lazy and don't want to work. If both eyes have similarly good vision and are in good health, then there is no case of lazy eye, even from childhood. So far, no one has found anything conclusive that can pinpoint the cause of a difference in degrees between both eyes. But it is likely to be genetic or environmental factors.
I have lazy eye on my left eye because I always use my right eye to see.
If I were to ask you to use one eye to focus on one object that is far away, chances are you will be using your dominant eye to do so, like this. It's not because that the other eye is lazy, but the brain has a preferred eye that it uses. So each eye sees a slightly different version of the object and the brain pieces them together. The brain does this so as to improve the image quality and also to give you 3D vision, which is the ability to perceive depth. So now that you know what lazy eye is, don't go around telling people that you have lazy eyes when you don't. Thanks for watching another episode of I Know La, and I'll see you in the next one.